be here 20-25 minutes at the max, so I will go ahead and get us started. So welcome to the IPCP dialogue, which is the last phase of the online course, the case studies, and now this live dialogue session. I can see by the list that all three of you, or at least two of you guys, were students. I'm not sure, Nina. I'm going to unmute you and ask you, Nina, are you a student with Dr. Frank, or are you one of her AETC directors?
I'm one of her AETC trainers.
Okay, well, welcome. So you are a nurse, and where do you work?
No, I'm not a nurse. I'm a psychologist.
Oh, a psychologist.
And I work at, Christiana Care in Delaware.
Oh, wonderful. Well, welcome.
Thank you.
And I'm gonna unmute people as I speak, and if you want to speak, you can go ahead and unmute yourselves. We do like dialogue. This is called the Interprofessional Collaborative Practice Dialogue Session. So if you can't speak, if you don't have a microphone, you can go ahead and call in through the telephone. You just have to change your audio to the telephone. Or you can just chat your responses in the chat or questions panel, and Melva or I will read them to the group. Okay, thanks, Nina. I'm going to go ahead and unmute you, Jessica. You're one of Dr. Frank's students?
Yeah.
Wonderful.
Yes.
Well, thank you. And I'm apologize, I don't exactly remember who you were, but I was at the school and did do that lecture about addiction and substance use and HIV, so welcome.
Thanks.
And you're very faint, so if you wanted to talk, maybe turn the volume up or get closer to the mic.
Is that any better?
Go ahead, say something.
Is that any better?
A little bit. It's a little faint.
Huh.
Let me turn
Not
my.
sure why.
All right. Well, it works for. We can hear you. It just sounds a little faint to me. I just did turn up my volume too. Okay. Well, welcome, Jessica.
Thanks.
So you're a public health student. And then let me go to Emily. Hi, Emily. You're unmuted. Go ahead and maybe try to speak.
Oh, hello.
Hello. Welcome. And again, you're one of Dr. Frank's students.
Yes.
So thank you for coming, and this again is the last phase of it. After this dialogue, we have one survey we'll email you, and then you'll be done. You'll get your certificate of completion and your gift cards.
Okay.
All right, I'm going to mute you for now, just because we might have a lot of background noises if we're all unmuted. Nina I spoke with, and I see. Do you pronounce your name Priyam?
Yeah, Priyam.
Priyam. Hi, Priyam.
Hi.
Welcome to the webinar.
Thank you.
And you are one of Dr. Frank's students as well.
Yep.
Well, thank you guys for participating, and I know you're getting ready for finals, right?
Yeah.
Starting to end the semester, so we'll make this as painless as possible. And then Melva, we were expecting Danielle, but she's logging in now, so we'll give her a second to log in. Okay, so I'm going to keep everybody on mute just for now, and then when we have some discussion, I'll try to unmute everybody and see how that goes with the background noise or not. So again, this will take about 20-25 minutes max. This is just a review of that online course, the case studies, and just the whole concept of interprofessional collaborative practice, focusing on, substance use and the role of substances in people's care, along with the focus on rural populations. So we realized that the students here, wait, let me stop myself. Melva, are you recording the session?
Yes, I am.
Yeah, we can't hear you if you're answering. Oh.
Yes, I am.
All right. Thank you. Oh, good. So we're only recording this for our records. We don't post it anywhere. It's just for our tallies. And we realize for the students, you may or may not work in rural populations, but in this case, we hope, if you do, we hope that you'll have a better understanding of maybe what some of the issues are around access to care for rural populations and its connection to substance use. And then I do know, Nina, I'm going to go ahead and unmute you. Do you want to tell us about where you work a little bit?
Well, where I work actually is inner city, but the AETC covers the entire state, and downstate Delaware is very rural and very limited access.
Yeah.
I train down there, so I'm familiar with the issues.
Yeah, and you all as students may be very well in the same situation that Nina just described. You know, you may work in an epicenter, like a more urban center, but you have to have service needs of people who live in rural populations. So I just wanted to make the connection for you all. Okay, and then I'm going to introduce the other participant that I saw, Danielle. I'm going to unmute you and say welcome to the webinar. You can go ahead and try to speak if you have a mic. If you don't have a mic, you can use the chat panel or the questions panel and just let us know your thoughts and your opinions on this. In fact, that reminds me to tell you all that I have about several poll questions that we're going to ask. And when we do get to those questions, all you have to do is click on the screen and that will submit your answer. We're not looking at individual answers. We're looking at the collective, so all the training participants. We put it in one big tally and we say, 80% I felt this way, 15% I felt another way. So you can feel free to say whatever your true response is. If it's no, you've never used anything, or you don't agree with it, feel free to say that. Again, we're not looking at individual responses, but collective. So please be honest. We have 6 polls, and again, they're just your opinions on the different concepts that were in the online module. Okay, so the whole point of this was for us to have this interprofessional collaboration with behavioral health specialists. Like Jim, he's a family counselor, and Marie is a nurse, and Irene is a nurse here. But we all take care of the same patient, and so how can we be more team focused to take care of patient needs, especially around substance use? So that was one of the overarching goals of this online course. So we're actually at the very first poll, so I'm going to go ahead and launch it. So here you can see the question on your screen, hopefully, and the question is, do you feel like, thinking back to the online course, that you already work as part of an interprofessional collaborative practice team? Now, for the students, I realize you may or may not be working, but just answer it to the best of your ability, like as you anticipate working, or if you are working, how you feel about working with, do you already work in a place that is interprofessional and collaborative? And I'm going to give it another second to see. Oh, good. We got everybody's votes. So I'm going to close it and share it. And then, Melva, you'll let me know when you've tallied it.
Okay, Holly, I've tallied it. Thank you.
I got to remember to hide it or else you won't see my slides. So here we go. Let me go on to the next one. This is the basic core concept that we are teaching to with the online modules and the case studies that you saw. And then also in those case studies, there were little video vignettes of the team interacting together. And we were really trying for what the Institute for Healthcare Improvement has deemed like three aims of healthcare improvement. So as you all know, we've been going through healthcare reform as a country. What does that mean? Why are we even doing it? Well, we're doing it so we can improve patients' experience with the quality of healthcare and be satisfied with healthcare, so they interact with healthcare more consistently and come in for prevention and not necessarily very, very sick. We also want to improve the health of full populations, and you guys in public health understand that better than I do, the concept of, each person that's a member of a community and then impacting the overall population within the communities. And then also we have a goal of reducing the per capita cost of healthcare, because we may be one of the most developed countries in the world, and we also might have one of the most high-tech healthcare systems, but sometimes our patient outcomes are the lowest around the world because we're not spending our money the best way we can be. And so here are the 3 aims, and this is just a schematic of how those aims intersect together, and the goal is to improve the individual's experience with healthcare, to integrate people's experience so that they're getting more full care for the whole person across the continuum, reduce that cost so we're using our money more wisely, and then focus on prevention and health promotion and not just disease and chronic illness. So those were overarching aims. We taught to this goal on the online course, which is for professionals to work together to build this safer and better patient-centered system of care. And so that was the basic goal that the modules were aligned with. And then within this goal, the Institute of Medicine outlined 4 competency domains that we should teach practitioners to. And these are having values and ethics for interprofessional practice, knowing our roles and the responsibilities within those roles and how they overlap, and then interprofessional communication, not just with professionals, but also with our patients, and then having to work better in teams and display teamwork. So now that I refreshed your mind about those competency domains, I'm going to ask our second poll question, and this one's a yes or no question. What do you guys think about those domains? And they're up there on the screen. Do you agree with them, yes or no? They're kind of too lofty. They don't really impact our work. All right, we got everybody's vote, so I'll close that and share it. And then Melva, I don't know if you...
Yes, I have the total. Thank you.
Okay, so let's keep plowing on. I'm going to keep track of time because I told you 20, 25 minutes max. So this schematic is just to display how all of these 4 competency domains intersect to improve, each patient's experience, but not just the patient, but their family that, helps support the patient. And then we would hopefully, by impacting patients, impact full communities, and then impact the population. That's the schematic there. And this leads to our third poll question. And this one is sort of, if you're asking you, are you having a hard time connecting the interprofessional collaborative practice domains with your daily work? And again, you are students, so just project out to your professional careers, or you might be a working student. So, all right, great. We're getting good responses in, And again, it's your opinion and your experience right now, having taken the course and what you're thinking about interprofessional collaborative practice. So here is the results of this question. And then when you're ready, let me know now with the tally.
Okay, I have the tally. Thank you.
Okay. So what's this connection? We talked about a very specific intervention, screening, brief intervention, referral to treatment, or SBIRT, and then this other competency building exercise around interprofessional collaborative practice. And we at our team believe that that's engaging in relationships that are patient-centered and providing patient-centered care. So if we look at somebody's substance use, even if it's not addiction, it's just risky substance use, and we relay that to other professionals about their overall health and wellness, that we're giving a better patient care and better patient experience. So in the modules, you were presented each of the core components of what is screening, what is brief intervention, and then on the case studies, we tried to pull that into a scenario, and then within the case studies, we also had those video vignettes that showed the team working and hopefully displayed interprofessional collaborative practice domains. So when you went through the case studies, we asked you to go ahead and think about these questions. Who's on the team and how do they work together? What are their achievements as a team? What were the patient outcomes? And what was that patient's level of satisfaction with team practice? So keeping those thoughts in mind, we went ahead and we just recycled David's case. The reason we like David is because he is an average guy who really had no medical or psychiatric history before he was diagnosed with fibromyalgia. So, he went through his life probably not accessing health care very often. But now that he actually needs it, he was thankfully diagnosed, and he is under a doctor's care. He's taking his pain medications and some sleeping pills. But David hasn't been able to work, so he's out of work and he's under a lot of stress from this life transition. David he works at a local warehouse, so he does manual labor, and a lot of times, he's living paycheck to paycheck, and he does rely on his physical attributes. So having this new health and change in his physical health has caused him some psychological stress. So David was taking his pills like he's prescribed. He took his sleeping pill and his pain pill, but he also continued to drink wine like he usually did before he was diagnosed and on medication. So he had several glasses of wine. Really, it's not that much. He wasn't driving. He was home. What's the big deal? But the next morning, his wife could not wake him up. She was very concerned he was too groggy and took him to the emergency room where he was more alert. So there's David. And we like to think about David in two ways. We like to compare and contrast David's situation without Espert and with Espert. So without Espert, we say David had 3 more emergency admissions within the year. He continued to use alcohol. He was still under stress, and he was rightfully in pain from his new diagnosis. So he started to rely on alcohol a little bit more, and he also decided to take his prescription medication the way he felt. He wasn't getting alleviating pain, so maybe he'd take a little more, or maybe he'd take a little less if he was trying to get back to work as well. But if he had had an Espert intervention, and we like to think about David as really understanding the seriousness of mixing alcohol and medication through education. We also would like to add extra social support for him and not just the medication intervention, because we know that he has a major life transition, and that's likely to increase his psychosocial stressors. So we want to increase support for him. And then we also want to increase his contact with his primary care physician so that he doesn't go to the ER for a crisis, but he's seeing more frequently with his doctor, which again is new for David. So what do you guys think about David? I'm going to go ahead and I'm going to unmute everybody and see how much background noise we have. I don't know. Let me just start at the top. Danielle, do you have a mic? You're unmuted if you want to talk. All right, maybe you can chat in the chat panel and let us know your thoughts on David. Emily, what do you think about David?
In terms of the fact that he's not for care? Is that what you mean?
Any impressions that you have about David? Yeah.
I mean, I don't blame him because he's used to, like, his normal routine, and when you get a life-changing event, it's hard to adapt to that, so I understand, like, why he chose to drink more and, all those things that combine to make him, his life change, so.
Yeah, his life really changed. Well, great. That's a good reflection on that. And then I see, let me see here. I did hear background noise, so I'm going to mute and unmute people. How about Jessica? What are your thoughts? Oh, you're unmuted, Jessica, if you want to talk.
Oh, I don't know. I kind of agree. It's interesting because he's not sort of it's not sort of the typical situation, I think, that you would think of with an alcohol problem and mixed with the prescription drugs. So it's interesting.
Yeah. Well, look, Danielle gave us some feedback, too, that we can compare with your thoughts, Jessica, and also Emily's. She says that Danielle is actually a pharmacist, and she sees it a lot. And a lot of the nurses that we've had on this see a lot of Davids. So maybe you guys haven't experienced David yet, but you will. Because, alcohol is very acceptable in our society, and people do not make the connection that it might impact their health or their psychosocial stress. In fact, a lot of people use alcohol in very low-risk ways. Like, it wasn't like he was knocking back 18 beers a night. He was drinking very low. But because of his psychosocial changes and his physical changes, it was risky for him. So it's something we need to educate our society about, alcohol use and its role in our lives. And it often goes undetected. And then let's see, Danielle also said it's complicated because there's a big push for collaborative practice, especially with PCPs to prevent patients from him getting into the emergency room. So it's just, yeah, we're seeing that in the workforce too, because people going to the emergency room, that's the most costly sector of our healthcare system. And yet they're not getting the right care because an emergency room is supposed to be like triage, right? Stabilize the patient, trauma. Really, care should be in the PCP office. The other place, Danielle, as a pharmacist, you would know about is that a lot of people go to the same pharmacist for years and years and develop trust. And so there's a lot of health care that can be delivered right through the pharmacy services. A lot of health prevention services, and even just people rely on their pharmacists to give them health information. So let me ask Nina her thoughts. And there's no right or wrong answer. We're just talking it through. So Nina, what do you think about David?
I think David is very, very typical. I agree with all of the comments that you just made. And also, when you were talking about the education about alcohol on top of pain medications, it's not even mixing the two, but the misperception in general that alcohol is a sedative and it helps you sleep, and people don't realize what happens physiologically once you go to sleep and that alcohol wears out of your system, you know, and the different changes that can go on there. It sounds as though from the scenario that's been presented that he did not get any extra psychosocial support along with education, which might have helped him to better understand, you know, what was going on when he had even 2 or 3 glasses of wine on top of those pain meds.
Yeah. That's so true. A lot of times people, again, because we're not very good at talking about all the effects of alcohol, they say, oh, it helps me sleep. It may get you to sleep.
But it doesn't keep you asleep.
No, it
Right.
will not stay asleep, and your body is, you know, not really getting the rest that it needs for sleep.
Right.
And then another thing we know from surveys of people who have substance use disorders, the number one reason that people turn to substances is not, oh, I want to party. It's to alleviate stress and anxiety. And we don't talk about like alternative ways for people, or maybe we don't reach them early enough when they start experiencing stress. Like David, being unemployed and having being a person. I mean, very few of us would want to be unemployed. It's very stressful. Well, thanks, Nina. Let me see here what Priyam thinks. What do you think? I'm sorry, it's Priyam?
Yeah, that's fine. I agree with what everyone's saying. I also think it would be very easy to help David to prevent him from going to the emergency room, and I'm like, he seems like a patient that would be willing to work with whoever, because no one likes going to the emergency room constantly. So
No.
I think it's something that, like, if people, like his healthcare team does work together, they can help him.
Well, we agree too. And of course this is an education scenario, so we set the stage for it. But we see a lot of Davids in society, and if we reach out to them quicker, sooner, let me just click through this slide. We already went through that. If we reach them sooner and more frequently before their problems manifest longer, they get sicker, more stressed out, and really develop more chronic conditions, we will impact that community health and the population health. Okay, so now I'm going to go through the series. I see it's 10:25, so I want to go through the last 3 questions so I can get you guys out on time. This question that you see here, I'm going to launch it now. So you may or may not have had a chance to do SBIRT. If you have been able to do any, how many have you done? Maybe it's none, 1 to 4, 5 to 9, or 10 or more. And then it's told, you know, obviously it's reflective of if you have the opportunity or not, so it's not a big deal. We'll share it. Okay, Nova?
I have the tally. Thank you.
You got it?
Yes.
Okay, the next question is, how often have you had a chance to use interprofessional practice competencies, those values and ethics? It may be never, or it may be 1 to 4. We just want you to kind of characterize how often you feel like you do these professional competencies. And if we haven't reached a time, then you can just hit other, like a time slot that is relevant to you. You can say, oh, it could be some other iteration of time, not what you have on this, what we've come out with. All right, let me share this. And if you're good, Melva, you let me know.
Yes, I'm good. Thank you.
Okay, and then our final poll is a yes-no question, and this one is asking you, do you feel like you've been able to implement something that you learned from the project, the online course, in your work or in your school projects? And if no, that's totally fine. We are just tallying it, just get an idea. All right, and let me share that with you guys. Nova?
Yes, I have the tally. Thank you.
All That was the last question. And again, we might be up to like having 200 participants through this. We're close to, no, I'm sorry. We have about 200 people in the online course, but we have about 100 people who finished all 3 components. So you guys are part of that 100. This is my last slide. It really is just talking about how those 4 competency domains, communication, teams and teamwork, values and ethics, and roles, meet together. And our goal is to improve each patient's health so that we can improve community and population health. We're really done with the rest of the session, but the next 2 steps of it are you will get an email in the next day or maybe early next week with the final survey link, and that shouldn't take very much time. You just click through and pick the answers you think are best suited. Then you'll get your final certificate, and you will get your final Amazon gift card. I'm just going to go down the list. Danielle, you can type in, were you able to get your first 2 gift cards? Let us know. Okay. And Emily, how about you? You're
I
on
only
mute.
got the first one.
Oh, you haven't got the second one yet?
No, only the first one.
Okay. You know what? We might be like a day behind processing, depending on when you finish the the course and the survey. So we'll double check on that. Melva, take some notes about like Emily needs certificate. She needs gift card 2 and 3. She will need 3 after the survey.
Okay.
Emily, do you need any CEUs like social work or nursing?
No,
Okay. But you do need a certificate of completion for Dr. Frank.
I believe so, yes.
So we'll get you that. And then let me see what Danielle said. You received everything, so thank you, Danielle. And then we will get Danielle, we'll get all of the students a certificate of completion, so that's for sure. Nina, do you need social work CEUs? Oh, you need APA.
No. No, I don't really need CEUs.
Okay. We could check on APA. Sometimes they will accept our courses if other entities have approved them, like social work.
Yeah, I don't need them. Thank you.
All right. Well, we thank you for your time, and you got your first 2 gift cards, okay?
I did. Thank you so much.
Well, we want to appreciate and thank you guys for your time because we know everybody's busy and running in a million directions. So let me just check in with Jessica real quick. Jessica, you got your first 2 gift cards?
Yeah, I had no problem.
Oh, good. So you'll look for the last survey, and then you'll get the last one and your certificate. And then Priyam, you're unmuted.
Yeah, I got both gift cards, and I just need the certificate of completion.
All right. Well, we'll get those out to you if today's Friday, so it'll probably most likely either be Monday or Tuesday. So be looking in your emails for emails from us.
Okay.
All right, everybody, we're done. So thank you for your time, and thank you for participating in this project. Take care.
Bye-bye.
Bye. Oh, Melva, you can go ahead and end the session because you want the recording on your computer, right?
Yes.
Okay. All right. Thank you, everyone.